The education landscape is constantly evolving. Staying ahead of the trends is essential. Welcome to EdBuzz LA County, where we explore groundbreaking initiatives, inspiring stories, and innovative practices shaping the future of learning here in Southern California. Assembly Bill 2085 brings significant changes to how child neglect is defined and reported in California. There are implications for mandated reporters, especially educators who are the second highest reporters in LA County and the entire state. Understanding these changes is crucial for educators in their role as mandated reporters. I'm Elizabeth Graswich, and I'm joined now by Dr. Debra Duardo, Los Angeles County Superintendent of Schools, and Brandon Nichols, Director of the Los Angeles County Department of Children and Family Services. Welcome to you both.
Thank you.
Dr. Duardo, we're going to start with you. If you could share a little bit about AB 2085. It narrowed the definition of general neglect. Can you tell our listeners a little bit about it?
Yeah, and it's so important that we're aware of it. This bill passed in January of last year. So the changes in the law makes it very clear that poverty is not a crime. And if a child doesn't have adequate clothing or food or a house, or a place to live, that's not really something we want to report to the Department of Children and Family Services. What we really want to do is educate our mandated reporters to identify that form of neglect due to poverty and really provide resources, services, support to the family to make sure that child's getting what they need.
Thank you. And Director Nichols, your agency has a very important role related to this. Can you share a little bit about the Department of Children and Family Services, as well as what you're really seeing in terms of the impact?
Happy to. And thank you for having me here today. So LA County Department of Children and Family Services, I'm sad to say, is the largest local child welfare agency in the country. We serve right now 22,000 children. Wow. We have over 12,000 children living out of the home of their parents and guardians. We run a 24-hour, 7-day-a-week child abuse hotline, and that's the mechanism that reporters use to report concerns about children. But we really have been struggling with the intersection of poverty and child abuse and neglect, and our system is not set up to address poverty. Having a social worker from our department knock on your door, having your child removed from you just because you can't access things that your child needs because of poverty is not an appropriate use of our system. And frankly, we've had a bad track record of separating families that were better dealt with by other resources and other support. So I'm really excited about the changes in the law. I'm really excited about some of our other initiatives that are going to better support families in the community, keep kids safely home with their families, and where we really only step in when there's an immediate sense of danger to the child. The kid's going to get hurt if something doesn't happen. That's our wheelhouse. That's our specialty.
And what are some of the changes that your agency is making to meet the demands of the new law?
So we're coming at it from a lot of different angles. And I want to say this is not about turning our back on children who need protection. In fact, those are the children we want to focus on. The problem is we've been focusing on cases where children are safe, and sometimes we miss the children that really need protection. So we want to be more narrowly focused on the kids that really need us. One of the things we've done at our hotline, we call it from the hotline to the helpline, is when a call comes in and somebody has concerns about a family that might be wobbling, but when we assess the case, we don't see a danger to the child, but we see a family that needs supports. We're able to refer that family to community-based agencies that we have contracts with and that we fund, that will go out and provide supportive services that aren't removal, that aren't foster care. That's what I'm really proud of. We've been running that now for several years. We've had a study of it, and the study shows that it's having a great impact, and I just want to grow it more and more. And then we also have our mandated supporter initiative, and we've been working with Dr. Duardo on that, rolling it out across the county. It's in its infancy. It is not going to be a switch that we just throw immediately and change the world. We're going to have to grow it. We're going to have to grow community capacity. We're going to have to educate people. But I think it does promise us a better future, and I think it promises families more support in the future?
You know, I think a lot of people probably don't really understand these calls and, you know, what happens around them. Yeah. Can both of you kind of weigh in terms of like, why are so many calls made in the first place? And then I think the other piece is people may not understand like what that impact is then on historically underserved and marginalized communities.
Well, I can start in terms of educators, and that means anybody who works on a school campus is a mandated reporter. And oftentimes it stems from a real genuine concern for a child. And for example, sometimes people will call from a school site will call to say a student's not attending school, or, you know, the student isn't getting adequate health care. Maybe they're asthmatic, or maybe there's some type of concern where the educator is concerned for that child's well-being. And they don't know where else to call. Mm-hmm. You know, they figure, well, let's just call the Department of Children and Family Services. This may be potentially considered under neglect, and let's call them and let them sort it out. But what we're realizing is that, as Brandon said, you know, they can't take the amount of calls that people are calling that are not substantial, you know, that they're not able to substantiate, because it doesn't fall under what the law requires as reportable. So sometimes I think it's educators trying to do the right thing, not sure where else they can get resources, and putting too much priority on DCFS rather than making those connections with, you know, nonprofit organizations or other organizations, or even services that we can provide internally to make sure that our children are getting the resources, that our families are getting the supports they need, and not bogging down DCFS with calls that don't fall under the law and really takes away from their good work on really addressing the cases that are more serious and that are eligible under the law for abuse.
Well, Dr. Duardo said it all really. I'll just expand it a little further. So we get over 200,000 calls to the hotline a year. Mm-hmm. Again, we're sadly the biggest local agency in the country. Of those calls that come in, about 7% result in us opening a case or substantiating an allegation. So about 93% of the calls we get, we determine do not meet the threshold, the criteria of a child being at either having been harmed or at imminent risk of being harmed. So we're spending time on cases that we shouldn't be, and not focusing on the cases where we should. Secondly, you know, it traumatizes families. There's a horrible statistic that I'm aware of, and every time I think about it or say it, honestly, I get chills. In our county, Black children, 30% of Black children have a hotline call made on them between birth and 18 years of old. Wow. So the over surveillance of the Black community, having social workers knock on their door, is having a horrible impact. And I think people are turning to us because they don't know what else to do. But I'll tell you, we get some calls that just shouldn't be made or should be handled by other agencies. Real world examples. Mom's a chef, neighbor calls. Mom's a chef, and she only gives the kids peanut butter. I mean, that's a concern, I suppose. Kids should probably have a more diverse meal, but having a social worker go out to your house thinking you might lose your children, thinking your kid might go into foster care is not a way to address they eat too much peanut butter. We have another call that came in. Kids are up too late at night. They're banging on the wall. I think it was an angry neighbor, to be honest. Mm-hmm. You know, they're probably tired of the noise and didn't know how to address it. So they called the child abuse hotline. But when we get those calls, if they use the right words, and I think maybe the kid's, you know, getting hurt, then we send social workers out. It's an abuse of the system. Mm-hmm. So I'm really hoping that we can educate people to know when to call and when not to call. But I'm also parallel to that, trying to build up community capacity. So if a kid's eating too much peanut butter, is there a place we can refer a family to for nutritional assistance, education about nutrition, maybe food resources? How do we get them some protein? It's probably not my system, but can we build capacity in the community and other systems to give alternatives to teachers that have genuine concern, but just don't know where else to go?
Yeah. Well, and the Board of Supervisors recently asked for changes related to mandated reporting. What prompted that?
I think it is the kinds of things we've been talking about. We've really been focused in this last 5 or 6 years on the disproportionality of our system. In our community, I believe it's about 7 or 8% of families are Black or African American. In our child welfare system, depending on where I look, it's about 22% representation. 22% or so of the calls we get, 22% of our open cases. We know there is a disproportionate impact that our system has had, and our board's very concerned about that. They also know that we are taking families apart where we didn't need to be because other systems have failed. Families have not had as easy access to behavioral health services, substance abuse services, and we're sort of a safety net of last resort. If a family wobbles too far, maybe a kid's about to get hurt and then we step in. It'd be better to build those other safety net systems, build out mental health access, build out substance abuse support. So the call never has to be made in the first place. And the board has given the whole county family a clear charge that that's what they want to see happening and not kids being unnecessarily removed from their parents.
Well, and Director Nichols earlier referenced that we have this great partnership on mandated reporter training. Can you share a little bit, Dr. Duardo, about that partnership and what we're doing together?
Sure. And I just like to add to what Mr. Nichols said about child safety. And this really is about ownership, that it's all of our responsibilities to make sure that children's needs are being met. And as you said, when we see a child that may need more food, adequate housing, better health care, that we're advocating and we're all coming together to support that family so they have access to those resources and services. But the reason why this training is so important is, like was already mentioned, that teachers are like one of the highest reporters of child abuse. And so we want to make sure that they understand the changes in the law. I mean, it changed recently, just last year, January, to change the definition of neglect, to make it very clear that poverty is not a crime. So we need to make sure that they're trained, that they get the resources and supports that they need so that when they do have a concern regarding a child, they know where they can get help. They know when and when not to report. They understand the devastation that occurs when a child is removed from their home, or even when a social worker comes and knocks on their door and is bringing this concern that somebody made an allegation of abuse in the home. I mean, that's very disruptive. Anybody who has children knows that if some stranger came knocking on your door and questioned your parenting or whether or not you were abusing your child, it would cause a lot of harm to that family. So we need to make sure that our educators are aware of the law, that they're trained on how to implement it properly, and that they understand where they can get resources, and also that they understand the disproportionality. And it's a real concern that our African American children are being reported at such disproportionate rates, and they need to be aware of their own potential bias.
Well, and I think maybe to kind of ease fears a little bit, it sounds like we have some protocols that are being put in place to help our families that are experiencing economic hardships. Can we share a little bit about that?
I could talk a little bit about that. And I want to start by saying I love teachers. And part of the reason why I love teachers is because they love kids. Mm-hmm. And, kids is my whole mission. I mean, my whole career is going to be, when I look back, about trying to help kids and families. And so I think teachers are a big part of that. And I really do think teachers are making calls because they don't know where else to turn, or they don't know what their duty is. So we're trying to put out some education so that teachers know when you call and when you don't. And we're trying to provide them with alternatives to calling the hotline that may better support families. But it's not about asking teachers to turn their back on kids. And I guess want to be clear. If any teacher thinks that a kid's being hurt, please call us. Well, that is our mission. We'll get out there, we'll assess it, and we'll make sure that kids are safe. But to guide teachers in making those decisions, and sometimes they're difficult decisions, we have launched a new website. It's supportingfamilies.lacounty.gov, and we have some tools on there. Today they're kind of pen and paper based tools. We hope to automate them in the future. And we will be launching resource guides so that teachers know other places they can turn when they see a kid that needs some help, but that it is otherwise safe. You know, if a family's trying everything they can do to take care of their kid and not going to hurt their kid, but that kid needs shoes, we're going to teach your turn to get a pair of shoes. That's the kind of thing that we want to, the tools we want to give so that teachers can continue to support and love the kids that they serve.
Yeah, you know, it's interesting because I was serving as a district administrator. I know how important this is for teachers, and they want to do the right things. And so it's just, you know, making sure that they, you know, have the right information. And so are there ways that school districts can ensure that there's a smooth transition as these new guidelines come in place?
Well, I'll start by saying, one, it's the awareness, making sure that they get the training and that they're aware of the changes in the law, why the changes were made, and what they can do differently to make sure that they are abiding what the law says when it comes to reporting child abuse. But I also want to say it's not just teachers, but oftentimes administrators or even the district at the highest level has made the decision to report and then allow DCFS to kind of sort out, you know, whether or not it's a substantial case. But, you know, sometimes it's about liability, and we understand that, but we really want to make sure that because, you know, if they get the appropriate training, that they'll understand that they are meeting their obligation as a mandated reporter. As Brandon said, all of us, our number one priority is making sure that children are safe. We would never say don't make a report if you aren't absolutely suspicious that a child may be at harm. But we really want to make sure they understand the difference in the changes in the law when it comes to general neglect, and that poverty, you know, being unhoused, not having adequate clothing or food isn't necessarily child abuse. It's really a strong sign that we need to come together and provide resources and supports to the families. So they need to get trained, they need to implement the new law, and they need to know where they can go so they don't feel like calling the child abuse hotline is their only option.
I want to thank Dr. Duardo and Director Nichols for telling us more about AB 2085 and the support being offered to mandated reporters. I'm Elizabeth Grasswich. We'll see you next time on EdBuzz.